and welcome. You're watching our show Health and Wellness Myths and Facts. I'm Sonal Mehrotra Kapoor. The pandemic has put mental as well as physical health and wellness into sharp focus. Throughout the pandemic, several coronavirus variants have emerged as the virus SARS-CoV-2 continues to mutate and evolve. In November of 2021, a new variant of SARS-CoV-2 coronavirus emerged and was named Omicron by the World Health Organization. Even if we have a virus that causes less severe disease, this virus can affect the vulnerable and the unvaccinated population. People with chronic diseases should be careful about the management of these conditions during this phase and the wave that this virus has caused. Diabetes and heart diseases both are leading causes of death in India. Relatively younger adults are getting diagnosed with these serious diseases. Both these chronic illnesses have substantial complications. It is easier to manage the disease if you are aware of the warning signals and problems associated with the conditions. Expert advice will help all of you to garner correct information and act accordingly. Joining us today on the show, we've got Dr. Saivigneshvar with us. He's MBBS, MD Internal Medicine, Consultant Physician and Diabetologist at Dr. Kumar Specialty Hospital. And also with us today is Dr. Kush Kumar Bhagat. He's MD DM Cardiology, Associate Director and at the Eternal Hospital in Jaipur. Hello and welcome to both of you on the show. Let me take the first question to Dr. Kush. Dr. Kush, as we look at the existing vaccines at the moment, which we do not know how effective or not they are against COVID-19, specifically against the Omicron variant, which is fast spreading. What would you say are the current vaccines that are available in India sort of weighing against the Omicron variant?
So actually, it's a very nice question. So two things I have to make clear, that the vaccines which are available as of now in India, both the Covishield and Covaxin, they are effective against the newer variant, that is the Omicron variant. But one thing you have to keep yourself in mind, that these vaccines, they do not prevent the infection of the virus. Even if all the population of patients who are being vaccinated, who have been vaccinated, or who have had COVID earlier, they can get infection. They can get the Omicron variant. But the important thing is that those population, those patients who have been vaccinated, the chances of getting severe COVID will be far less than those population who are unvaccinated. And this is the important reason. This is very important why we need to get vaccinated, because vaccination is the only thing which will prevent the severe form of COVID. It will not prevent infection. Even if you have COVID, you have been vaccinated, you can get Omicron. But severe form of COVID will be definitely less if you have been vaccinated. And that is why I urge all the people to get vaccinated, to get the booster shot, because the severe COVID, this will prevent you from getting severe COVID. Along with that, all the the protocols which the government tells to wash your hands, follow social distancing, and all these things you have to follow in order to get get yourself protected from COVID.
I see. Thanks for that. Let me take the next question to Dr. Saivigneshvar. Doc, how many strains of COVID-19 are there in the country right now? And why is the new variant Omicron classified as a variant of concern? And, a lot of times people think it is just Omicron, when a lot of debate is already on in the country on how there could still be Delta and then there is Omicron. And just to sort of keep our mind out for the fact that this is not the last variant that we've seen in course of this pandemic, there could be more coming.
So we generally classify the variants into two. So one will be the variant of concern and one will be the variant of interest. And we have 5 variants of concern and 2 variants of interest. And the common variants of concern that we have are the alpha, beta, gamma, delta and the Omicron. And 2 variants of concern which is going to be your influenza and delta cron. So Omicron is a variant of concern because it has an increased chances of transmissibility. Any variant which has an increased chances of transmissibility or increased virulence will always be considered as a variant of concern. And yes, there is high chances of many new variants to be discovered in the future, and that is always the need. That always puts us in the need for keeping our mask up and getting vaccinated.
I see. A follow-up question to that then, Doc, is some people are already suffering from long COVID effects, right? How many of these people are susceptible to Omicron? What extra care should people with comorbidities be taking as of this moment?
So we generally call these people as the long haulers, and it's called a scenario of long COVID. And though there is no active virus running amok in the body, these people's immune system as well as their health are very debilitated. And there is no direct link between these people and the chances of developing Omicron, but there is always a very high need for these people to keep their sugars under control as well as their other comorbid conditions, because with the right control of your sugars, you will have a very good immunity, and this will definitely help in fighting the Omicron. Though it is a variant of concern and though it is a variant of easy transmissibility, always with a good immunity, we can fight the variant.
I see. All right, the next question for Dr. Bhagat then. Dr. Bhagat, it is said that Omicron doesn't affect the lungs very severely, but should people with pre-existing heart ailments and people with diabetes not worry about the new variant at all, or do you think they are at risk?
So there are two things. First of all, it is definitely sure that the Omicron variant is definitely not as severe as compared to the Delta variant. But I don't think it will be right to say that Omicron cannot cause severe disease. Patients who have pre-existing lung condition like lung disease like asthma, tuberculosis or any other lung ailment, if these people get COVID infection, get Omicron, then they can definitely get the severe form of the Omicron and they can get respiratory distress, pneumonia and the decrease in oxygen levels. So these people have to be cautious against this Omicron variant. Now, the second part of the question is, what about heart patients and the diabetic patients? See, all these patients who have heart disease, who have diabetes, who have lung disease, who have kidney ailments, all these patient population are at risk of getting severe form of the Omicron. So because their immunity levels, the fighting capacity of the body is far less as compared to the normal population. But there is nothing to worry about. So what these people need to do, so they have to follow certain things. First, get vaccinated as soon as possible. Continue taking your heart medicines and diabetes medicines along with the other medications which have been prescribed by the doctor. And third, so you have to follow all the protocols of the COVID guidelines. So by getting all these things done, definitely you can get yourself protected against a severe form of COVID.
All right. Dr. Saivigneshvar, the same question to you on how much of a risk are diabetics and those with heart diseases when it comes to Omicron?
Yeah, so the risk of people living with diabetes is always directly proportional to the amount of incidence and the prevalence. But when it comes to the Omicron variant, it is a variant of less severity and increased transmissibility. So all diabetic patients should have a very good control of their sugars. So when you have a very good control of the sugars, there's high chance of you to fight this Omicron variant. Because normally, when the Omicron variant has an increased susceptibility to infect people who are already infected. So when a diabetic patient who is already infected with COVID has always an increased chance compared to a normal person who has been already infected with COVID. So a diabetic who is a long hauler infected with COVID should always keep his sugar under a very tight control. And some of the easiest methods to do it is always to have a good lifestyle, to always have a good diet, to always reduce the amount of saturated fat that you are taking. So by this way, the diabetics can definitely fight the Omicron variant.
I see. Just want to move away from Omicron to just a question on diabetes now. And Dr. Saivigneshvar, if you can take that as well. What additional testing is required, you think, if two different test results are discordant for diabetes diagnosis?
It's a very interesting question, actually, and we see this in our day-to-day OPD. nearly 20 to 30 people will come with a sugar report who will not be a known diabetic, and will show that, doctor, I'm having fasting and postprandial in range, but my HbA1c is abnormal. Sometimes the patient will come with a fasting in range and a postprandial being abnormal. So always when such a scenario comes, the one test which has a value above the diagnostic threshold will always the patient to repeat the value in a span of 24 to 48 hours. So by this means we can, when again the value comes out to be on the higher side, it's always a need of time for the patient to be put on a diabetic diet, a diabetic lifestyle, and a medication. Always keep in mind, it's always best to do 3 tests for diabetes. One is going to be your HbA1c, which is going to show your average blood glucose level for the past 120 days. And next one is going to be your fasting blood sugar levels. And the third one is going to be a glucose tolerance test. So normally the people who will be mostly present with the discordant values will be those in the pre-diabetic range with a fasting value of 100 to 125. So these people will classify them as a pre-diabetic. So these people have been commonly encountered in the OPD to have 2 discordant values when they do a different test pertaining to diabetes. So these people, when they are put on a good lifestyle with a diet modification without being put on a medicine, they can definitely delay the chances of them falling into a state of diabetes.
All right. Thank you, Doctor, for that. With that, let's slip into a break. When we come back, we'll continue with this conversation. You're watching Health and Wellness. Welcome back. You're watching Health and Wellness, Myths and Facts. I'm Sorol Kapoor, and we are in conversation with our panel of experts. Let me take the next question to Dr. Bhagat. Dr. Bhagat, can heart failure occur in young people? And what is the consequence of not availing timely treatment for heart failure? In fact, more of a statement than a question here, because in the past 1 year at least, we've seen so many young people succumb to heart attacks and actually lose their lives to it.
Yeah. So actually, this is a very important question. So first of all, we need to understand that heart attack and heart failure, these are 2 different entities. In heart attack, there is blockage in one of the major arteries, which causes chest pain, which we commonly call as angina, and patient suffers a heart attack. What happens in heart failure, that the pumping capacity of the heart, it decreases. It decreases so much that the pumping capacity of the heart becomes less than 35%, and we call it as a severe form of the disease. And these heart failure patients, they develop symptoms of breathlessness. They develop swelling over the lower limbs, on the face, on their abdomen, and they develop breathlessness as a major symptom. So both these things, heart failure and heart attack, both the things can happen. And in fact, nowadays, these are more common, in fact, in younger population. There are a lot of reasons for development of heart failure or heart attack in younger patients, like the problems in the valve, problems in the muscles, or problems in the vessels, and more so the lifestyle changes. The lifestyle, whatever the younger population are using. So because of that, there is a major shift in the heart disease from the older population to the younger population. Now, the second part of the question is consequences of not availing proper treatment of the heart failure. So if your pumping capacity of the heart is less, and if you don't take proper and timely treatment, then what will happen is there's a risk of sudden cardiac arrest. There's a risk of sudden cardiac arrest which can happen if the pumping capacity of the heart is quite less. But what is important is to take proper treatment, achieve a good lifestyle modification, eat properly and drink properly, and have regular exercise. So this will definitely decrease the risk of development of heart attack and heart failure in younger population.
See, thanks for that. That's critical information there. Dr. Saivigneshvar, let me come to you next. Insulin resistance is a major risk factor for diabetes, but insulin resistance does not just cause diabetes, is that correct? It also affects other body mechanisms as well. How exactly then does insulin resistance affect your lipid accumulation, for example, and can it be managed?
Actually, it's a very interesting question, and we all know insulin resistance is one of the commonest cause for development of type 2 diabetes mellitus. So one of the main factors that the insulin resistance affect is it will cause a very resistance, and it will cause an increased resistance to weight loss. So this will form as a vicious cycle and will definitely affect a lot of your body parts as well as your organ systems. Before taking this question, we should first know what is an insulin resistance, because insulin resistance is quite a generalized topic which everyone has to know, and it can be explained pretty simply. So when you have any food in excess of your need, for example, a place where you are supposed to have a 2 portion of a food, you are going to have one more extra portion. This extra amount of food is going to enter the fat cells that is present in your body. So the fat cells always have a portal of entry, which is called your insulin receptor. So this insulin receptor will be acted by the insulin. So an insulin, which is produced by the pancreas, will go and act on the insulin receptor to push this excess amount of food inside your fat cells. So once the food is being pushed inside your fat cells, the size of the fat cells will start increasing. So as you keep on increasing the amount of food that you take in excess of your needs, the fat cells will start and will keep on getting increased beyond a size limit. So after a limit, definitely the fat cells can't take it up more, and at this scenario, the fat cells will decide to change the shape of the insulin receptor. So this insulin receptor is going to be your lock, and the insulin is going to be your key. So when the insulin receptor is going to change the shape, the insulin key can't fit into the receptor. So this is going to be the scenario of insulin resistance. So you'll have a very big fat cell with the insulin not being able to act on an insulin receptor. So this is going to develop a lot of abnormalities, especially a very depressed immune system and a very resistant to our medication for treating a diabetes. So a very easy method for this, but also a challenging one for this, is going to be reducing your body weight. So always remember, the fat cells can never be destroyed. It can only be shrunk in its size. So when you start taking the food that is needed, and when you start cutting down your calories, the fat cells will start changing its shape and will come gradually back to its normal shape and the normal size. So once the fat cells start coming to its normal shape and the size, automatically the insulin receptor will reverse the changed shape, and the insulin will be able to function normally into the insulin receptor. So this will help the patient to gain back the diabetic control with a very decreased amount of insulin levels and with a very decreased amount of diabetic medication. So by bringing your weight down with a proper lifestyle and a proper medication, you are always going to be having an upper hand with the insulin resistance fight.
I see. All right. Let me take the next question to Dr. Bhagat then. Dr. Bhagat, can heart failure be cured? Can a person with heart failure have a long life ahead? And typically, how long can a person with heart failure actually survive?
So a very important question, ma'am. So first of all, I would like to tell that there has been a drastic, development in the field of heart failure. Nowadays, we have a lot of medications which can actually increase the pumping capacity of the heart. As I have stressed earlier, that in heart failure, the pumping capacity of the heart gets decreased. So what these medications will do, what these latest medications will do, it will try to improve the pumping capacity of the heart, and it will try to decrease your symptoms of breathlessness. Now, even if your heart failure symptoms are not controlled by the medicines, what we can do, we have special kind of pacemakers, which is called as CRT. So what it will do, it will try to synchronize the heart and improve the pumping capacity of the heart. So this is a very, it's a very important thing which can improve the pumping capacity of the heart. So there are subset of patients who do not even respond to this treatment or the previous medications. What we have for those are special assist device. We call it as heart assist device or LV assist device. What it does, again, it tries to improve the pumping capacity of the hearts. It supports the heart to improve the pumping capacity of the heart. And those patients who get this device can lead a normal life. And last but not the least, even after achieving all these things, if patient doesn't get relief, then the ultimate option is the heart transplant. And we all know that nowadays heart transplant in India is a lot of patients are undergoing heart transplant in India, and there are a lot of developments in the organ donation as well. So Heart transplant patients also. So if you get a heart transplant, then if you're taking proper medicines, you can lead life, you can have an increase in life up to 20 years. So definitely there have been a lot of advancements in the treatment of heart failure. Heart failure patients can live a normal life. They can live a normal life, but there are certain things which they need to understand. They have to take proper lifestyle modifications. They have to follow doctor advice, and timely treatment and proper treatment by all these devices, by all these medicines, by the LVSS devices. If they take all these things, then their life can definitely be prolonged and they can achieve a normal life just like a normal population. So this is how we can cure or we can treat heart failure.
I see. Let me take the next question to Dr. Saivigneshvar. Doc, it is generally believed, and you were also mentioning this in your last answer, that people with bad lifestyle are more susceptible to diabetes and other chronic conditions as well. However, can a person with a reasonable good lifestyle also have diabetes? If yes, what could be the probable causes for that?
Okay, so that's an interesting one. Yes, definitely a person with a very good lifestyle can develop diabetes. With lifestyle, we are always mentioning and we are always indicating good exercise, a proper diet. But we are always forgetting a very big thing, which is going to be a stress. So a person who's quite stressed or who's having a very stressful lifestyle will definitely start developing diabetes. And the very most important type 2 diabetes is going to be a genetic factor. So genetics plays a very predominant role in development of diabetes. Yes, a very good lifestyle will definitely play a role here, because when a person is genetically susceptible to have a risk of developing diabetes, with a very good lifestyle, we can push the age limit of him developing a diabetes to a later stage, so that he can always enjoy his sweets at an young age. So always putting a restriction on your sugar intake at a very later age is very comfortable compared to an early age. Apart from this, the other factors that is going to play a vital role is a development of fatty liver. And nowadays we can see most of the patient, when you do an ultrasonogram, they will come to you with a report saying they have developed a fatty liver. Yes, this fatty liver has a very, very, very increased chance of people developing a diabetes. So fatty liver again can be modified with a very good lifestyle, but that alone can't prevent a person from developing it. So always remember, just with a good lifestyle, you can always have a very good control on your life, but also it should be a stress-free life, and this stress-free life will help you in developing things pretty late age, but there is always a higher chance that when you're genetically susceptible to be developing diabetes. But with the right diet control, without a need to take the medicines, you can always control your diabetes.
I see. Let me take the next question to Dr. Bhagat. Then, Dr. Bhagat, cholesterol-lowering drugs can lower the risk of heart attack, but also you have a heart attack. Is it too late to benefit from these cholesterol-lowering drugs? And what would your recommendation be to younger people also who could be asked to be on these drugs?
Important question, ma'am, because we all think that only obese population will have derangement in the cholesterol levels, but it's not that. So even if you are thin and your diets are not proper, you can have derangement in your cholesterol level. And we all know that high cholesterol level can lead to blockage in your arteries and can cause heart attack. So this is a very well-known fact. So, but even if you suffered a heart attack, if you have already suffered a heart attack and you have undergone angioplasty or stent implantation or an open heart or a bypass surgery, then should you take the cholesterol lowering drugs? Yes, you have to take the cholesterol lowering drugs, because even if your cholesterol levels are low, these medicines, they have got special effects. What they will do, these medicines will not only these medicines does not only lower the cholesterol levels, but they prevent the further blockage in the heart. If you have undergone a stent implantation, it will prevent the future blockage in your stents or the bypass. So it is very, very important to continue taking the cholesterol lowering medications, because it has got a lot of pleiotropic effects. It does not only decrease your cholesterol levels, but it prevents the further blockage in your arteries. And apart from taking cholesterol lowering medications, every patient, irrespective of the fact whether they have undergone angioplasty or whether they have heart disease or not, they have to they have to take lifestyle modifications in their day-to-day practice. Eat less of cholesterol. And the last part, young population. Yes, the younger population. I'm seeing a lot of patients in my OPDs that younger population have rise in their cholesterol levels, and the most important reason is their improper lifestyle. So, by achieving a proper lifestyle modifications, you can decrease your cholesterol levels and continue taking cholesterol lowering medications even after you suffered a heart attack.
All right. Thank you both for joining us with such insightful answers on the program. I'm afraid that's all the time we have. Thanks so much for watching to all our viewers as well. Goodbye.